How's it going, everybody? Braddock here, and today we're looking at the Mystery Ranch Rats Pack. Y'all check it out. Alright guys, welcome back. So once again, this is the Mystery Ranch Rats Pack. Now before we even dive into this, the contents of what's in this bag may not be best suited for you. Again, it's all dependent on what you're doing. What I have in this pack, my loadout, it may change the next day. And that's why I love this pack, simply because of how modular it is. I can rip out everything I need and throw in stuff I do need for that occasion. So keep that in mind. The contents in here is dependent on, again, what you're doing for that particular day. So let's go ahead and jump in. We'll start off on the side. This is the North American Rescue Traction Splint. It has been super awesome, a little bit expensive, but I highly recommend you guys check this out on eBay. They have a lot of expired, I guess you would say, medical equipment on eBay that you could buy fairly cheap. So again, the North American Rescue Traction Splint. On the front of the bag, we have the two pouches here, and this is considered your blowout kit. Again, something I like to change. I might throw everyday carry stuff in here, some MREs, whatever the case may be. But if we open this guy up, since this is an aid bag, I like to keep a IFAK that I've put together. This is a vacuum sealed IFAK that contains combat gauze, a tourniquet, a Gen 7 cat by North American Rescue, a 6-inch Israeli bandage, a chest seal, North American Rescue ARS decompression needle, that's the 14 gauge 3 1/4 ARS decompression needle, and then we have also a chem light wrapped in 550, as well as an NP8 with lubricant and tape. So pretty much everything you would see in an IFAK, I have in this small little vacuum sealed pouch here. And then behind that, a TCCC or Combat Casualty Identification card. And then if we move to the other side, we have the same exact thing. So again, an IFAK that has been vacuum sealed with a combat casualty card to go along with it. And if we move to the front of the bag, as you can see, we have two more North American Rescue Cat Gen 7s, and to go along with that, a large permanent marker for timing your cat. And then behind that, we have some large North American Rescue shears with the scissor leash, as well as some non-latex gloves to go with it. If we move to the bottom, there are some buckles here so you can hold any type of litter. If we unzip this here, and the great thing about all of these zippers is they are also doubled with a small little button there to keep that in place. We'll open this guy up, and now something I don't really carry with me a lot just because of the weight is this guy right here. This is the Rat Strap by North American Rescue. You can attach this to your belt and then run this around somebody's plate carrier straps or their grab handle, and use that kind of as a extraction device. So again, I think webbing is awesome. There's a million different uses for webbing, but again, this is something that more than likely I just keep at home. Now next to that, since we are talking about extraction, I have a North American Rescue quick litter. This litter is rated up to roughly 750 pounds. It is pretty compact, and as you can tell, again, I vacuum sealed this and have a quick pull tab here on the upper hand corner so I can get to it and access it fairly quickly. And then another item we have in here to go along with that litter is a blizzard survival blanket, because in a trauma situation, making sure our casualty is warm and not suffering from hypothermia is very crucial. Alright, so let's go ahead and jump to the lid of the bag. A few things going on here. We have some over-the-counter meds in this North American Rescue storage container. Next is pretty much everything for vitals. So a pulse oximeter to check O2 sat. Next we have a portable electronic BP cup. We then have a small pen light to check pupils. And what I like to do is throw a small piece of tape underneath that just to stop, say this is in your bag and that's being pressed down, to stop that from turning on. A thermometer with lubricant to check for a core temp. And then we have a small glucometer kit. And last but not least, for vitals, something I've been very fond of, this is the Cardiology Littman 3 stethoscope. Can't go wrong with more PPE. And if we dig a little bit deeper, we have a few different sizes of needles as well as syringes, both 1 ml, 3 ml, 5 and 10 cc syringes. And then we have a couple other tools, some hemostat, gauze scissors, 11 blade, etc. So one of the greatest thing about this pack is the clamshell opening configuration. So you have a large buckle here, another large grab handle, in which then you can open up all the appliances inside your bag. So one of the things I like to do is base all my kits off of the March algorithm, MARCH, that's massive hemorrhage, airway, respiratory, circulation, and hypothermia. And again, I label all my bags to keep everything quite organized. So the first thing first is bleeding. I keep it in this pouch here, which has the red handle labeled as bleeding. And inside we have some combat gauze, a couple 4-inch Israeli bandages, a triangular bandage or cravat, 2 of those, and then some ABD pads and other 4x4 gauze pads. And then moving into Airway, a few things going on here. We have a small little Crike kit, some more gloves, and I try to keep gloves in every bag just in case I don't have any PPE on hand at the moment. I can go ahead and open up that bag, and the first thing you'll see is a set of gloves, several OPAs, several sizes of NPAs, and a size 3 and size 4 eye gel. And moving on to respiratory, a few items in here to include a pocket BVN, 2 ARS decompression needles. Once again, this is the 14 gauge 3 1/4 decompression needles, and a peripheral of hyphen vented chest seals. And moving into circulation, we have 2 IV bags. And the cool thing about this is once you get your IV started, you could then hang this bag and you could see the contents of your fluids and where you're at with each IV bag. So let's go ahead and jump in real quick. Each bag I keep a small sharps container, and then we have 2 500 ml bags of normal saline. Now I am a huge fan of running 500 versus 1,000, simply because now you have a 2 is 1, 1 is none type deal. Versus 1,000, which takes up a lot of space, I can now treat 2 patients. So on the back of these, I went ahead and taped up your tubing, and then on the inside we have your start kit with quite a few different gauge catheters to include a 18, 20, 22, and 24, all in this small little package. And the last pouch is designated for miscellaneous items. And inside here, we won't quite dig in, but it's just small laceration repairs, a lot of small boo-boo stuff. So to include some Durban bond, steri strips, some Coban, another ACE bandage, a way to pack a small wound, some 3-inch tape, several 4x4s, lac repair kit for doing some type of sutures, etc. So quite a few things as far as boo-boo kit goes inside this miscellaneous bag. And down at the bottom, what I like to do is it's always very difficult to keep some type of introducer. This is a bougie in your bag, and I like to go ahead and just line the outside or the inside bottom of my bag, and that kind of keeps this nice and tucked away when not in use. Moving on, we have another set of 4-inch North American Rescue shears, and then each compartment on the side of the bag we are carrying 4-inch Ace bandages and 2 SAM splints. And last but not least, we have 2 C-collars, so one for adults and one for pediatric. That about wraps it up. Y'all make sure to like and subscribe down below. If you have any questions or comments of further videos you'd like to see here in the near future, feel free to let me know. I'm Braddock. Y'all stay ready.